Patient access to information in whatever way it comes is paramount to the success of care. It's paramount to patient safety. Give you an example. My future mother-in-law fell at home, and I, as a patient advocate, gather up her information, gather up her medications, and head to the hospital. Cool, we think everything's going well. Get to the hospital, and we started a series of data misinformation. That misinformation included not having the ability to take her medication list and put that into the medication history, except as a blob from a PDF. It included having information at the point of care that was not current. A cast cart came into the room, and yet the nurse didn't know results were in. Lifted my future mother-in-law up, had her stand, the cast cart. She had a broken leg. It continued to have misinformation and misinformation. Patient access to the medical records saved her life. She was discharged from the hospital, presented to a long-term care facility. My fiance then went to the long-term care facility and noticed that she was still wearing her temporary cast. He asked to look at the record. They said, well, you don't get to look at the record. And he said, wait a minute, you're a meaningful user. I have the right, I have a power of attorney, I want to see the record. He was told, you won't understand it. He looked at the record. He discovered a lot of things he didn't understand, but what he did understand is no doctor had ever looked at her from the emergency room and her 2-day stay at the hospital. And the cast was on the wrong foot, and it was a temporary cast, and she'd been walking on it for 4 days. So she'd been walking on the broken leg, and her good leg was in a temporary cast. I then called the hospital. We had an ambulance take her from the hospital, long-term post-acute care, to the hospital. She had very, very high anxiety levels, and her white blood count was not good. And she had some enzyme levels that were too high. Well, guess what? No one did a query to see where information was about her. There was no mechanism to send an email and say, do you know anything about this particular patient? And so the provider then decided that with this level of anxiety, with no other symptoms, they would do a cardiac catheterization. It was a completely unnecessary task, but the doctor on call was a cardiac surgeon, and so that's what he did. So she ended up having a cardiac cath. I was in Washington, D.C. I called and I said, look, I need to see the record too. I'm here with a bunch of doctors. We're going to check it out. To the point where the doctors looked at the record with me, because I did have access through the law, and we determined that most of this care was completely either wrong or unnecessary. She was then, I called back and I said, guys, just have them wash their hands. I mean, we're that fundamentally at disconnect, misinformation all the way around. Just make everyone wash their hands, because she had now an open wound. She was discharged back to long-term post-acute care. She never recovered. She actually died in long-term post-acute care for an injury that should have had her home in 3 days if the cast was on the right foot and they hadn't done the cardiac catheterization. So why get involved in interoperability? Every one of us can have a story about how they themselves or their family member was not getting appropriate care because the information was not available, the information was not correct, it was not timely. So why do I believe in direct trust? I believe that a trusted framework that includes the patient means that all of us can co-produce health in the ways that the patients prefer. That's why.